Former President Jimmy Carter revealing new details today about the extent of his cancer and the treatment he's undergoing now.
So I feel at ease about it, and I've been very lucky that the Emory doctors have been able to control any aspects of pain from the operation or from the presence of cancer.
At a news conference, the 90-year-old said he has melanoma that was initially discovered in his liver. He underwent surgery for that in early August, and about 1/10 of his liver was removed. Carter began radiation today to treat 4 lesions found in his brain. San Diego 6's Nancy Aziz has more on this type of cancer and the prognosis.
And we make sure everything is right on.
Preparations at Sharp's Neuro-Oncology Center to treat a patient with brain cancer. Likely a similar scenario played out prior to President Carter's initial radiation treatment today.
This is a skin rendering of the actual beam entrance and exit.
Radiation oncologist Dr. Siavash Jabbari has treated many patients suffering from the same type of cancer the former president now has. That's melanoma that's traveled to the brain and liver.
The most common type of brain tumors are not brain tumors that arise in the brain. They are brain metastases, meaning they are cancers that start elsewhere and eventually spread to the brain.
Experts say 170,000 Americans will be diagnosed with a brain metastasis this year. Jabbari says they can be challenging to treat.
Melanoma traditionally has been a cancer that's been very tough to treat, especially when it spreads. It tends to be more resistant to the conventional treatments, such as lower doses of radiation and more of the conventional chemotherapies.
But Jabbari says newer treatments are providing better outcomes. Targeted radiation, high doses that hit just the tumor and spare everything else, are proving effective, along with chemotherapy or immunotherapy.
So this is sort of like a topographic map.
Jabbari showed us the radiation plan for a brain tumor. The blue spot in the center shows the area of intense radiation with areas of decreasing radiation surrounding it. Protecting healthy tissue during the procedure is key to giving patients quality of life after treatment, says Jabbari. He says Carter's type of cancer is not curable, though it's treatable. While Carter says he plans to cut back on work, he says he also wants to continue teaching Sunday school.
I tend to tell my patients not to deprive themselves of the things that give them joy. Now, whether that's enjoying time with family and friends, some reasonable work activity or hobbies.
Jabbari says effective treatment can give patients with brain metastases many, many months, even years. Nancy Aziz, San Diego 6 News.
While melanoma usually starts with a lesion on the skin, that is not always the case. Dr. Jabbari says it's usually preventable by protecting yourself from the sun. And he says perhaps the former president's time as a peanut farmer may have caused him to get skin cancer.